87% of Americans over 70 have some stage of chronic kidney disease. That is not a guess. That is from the National Kidney Foundation. Your doctor checks your blood pressure. Your doctor checks your cholesterol. Your doctor checks your blood sugar. But there is one number sitting on your basic blood panel right now that could save your kidneys. And almost no doctor explains what it means. By the time you feel symptoms, you have already lost more than half your kidney function, and you cannot get it back. I'm Dr. Garrett Thornton, 34 years in internal medicine. I don't sell supplements, I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. Picture this. You wake up on a Tuesday morning. Your ankles feel a little tight. Your shoes are harder to put on than they used to be. You had to get up twice last night to use the bathroom. You brush it off. You think it is just getting older. You pour your morning coffee and take your usual handful of pills. One for blood pressure, one for cholesterol, one for your stomach. Maybe one more for allergies. You feel fine. But something is happening inside your body right now that you cannot feel. And that is exactly what makes it dangerous. I spent 34 years watching patients walk into my office feeling perfectly fine. Their blood work would come back, and there it was. A number most of them had never heard of. A number I am about to teach you. The myth most people believe is that kidney disease has symptoms. It does not. Not until stage 3 or 4. By then you have already lost 60% of your kidney function. The other myth is that kidney disease only happens to diabetics. That is wrong. High blood pressure alone causes 1 in 4 cases of kidney failure. Here is how your kidneys actually work. Think of them like 2 coffee filters. Every single day, your kidneys filter about 50 gallons of blood. They pull out waste, extra water, and things your body does not need. They send the clean blood back, and the waste goes out as urine. Now imagine your coffee filter gets clogged. Slowly. A little more each year. The coffee still drips through, but it takes longer. Some of the grounds start slipping through. That is what happens to your kidneys after 70. The tiny filters inside them, called nephrons, start dying off. You are born with about 1 million in each kidney. By 70, you might have half that, and they do not grow back. The number that measures this is called your GFR, your glomerular filtration rate. That is the number your doctor has, but probably never circled on your lab report. A healthy GFR is above 90. Below 60 means stage 3 kidney disease. Below 30 means you are heading toward dialysis. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage. Liver disease or cirrhosis. Diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. Let me tell you about Frank. Frank was 74 years old, retired postal worker from Columbus, Ohio. He walked 2 miles every morning. He ate what he called a sensible diet. Cereal for breakfast, sandwich for lunch, meat and potatoes for dinner. Frank went to his doctor once a year for a checkup. Blood pressure was 142/88. His doctor said that was fine for his age. Cholesterol was managed with a statin. Fasting glucose was 108. Just a touch high, but nobody seemed worried. Frank felt great. Then one year, a new nurse practitioner looked at his lab work. She circled a number Frank had never noticed. His GFR was 47. That meant Frank was already in stage 3 kidney disease. His kidneys had been declining for years. Nobody told him because nobody explained that number. Frank had no pain, no symptoms, no warning at all. The damage was already done. His creatinine had been creeping up for 5 years straight. It was right there on every lab report. Nobody circled it. Here is your first test. Look at your most recent blood work. Find the line that says GFR or eGFR. If it is above 90, your kidneys are working well. If it is between 60 and 89, you are in early decline. Talk to your doctor about monitoring it every 6 months. If it is below 60, you need a kidney specialist. Today, not next month. Now here is the part most people miss. A single GFR number does not tell the full story. You need to see the trend. Ask your doctor to show you your GFR from the last 3 to 5 years. If the number is dropping more than 3 points per year, your kidneys are declining faster than normal aging. That trend matters more than any single number. Here is your second test. Look for the line that says albumin to creatinine ratio, or ACR, on your urine test. If your doctor has never ordered this test, ask for it at your next visit. A normal ACR is below 30. Above 30 means your kidneys are leaking protein. That is one of the earliest signs of kidney damage, and it shows up years before your GFR drops. Many doctors skip this test for seniors. They should not. Now, the things that speed up kidney damage after 70. First, ibuprofen, Advil, Motrin, any NSAID. Even occasional use after 70 can reduce blood flow to your kidneys. One study found that regular NSAID use increased the risk of kidney decline by 32%. Second, dehydration. Your thirst signal weakens after 65. You are not drinking enough water even when you think you are. Your kidneys need water to filter properly. Third, too much protein powder. Yes, protein is important for muscle, but megadoses of protein supplements force your kidneys to work overtime. If your GFR is already below 60, high protein intake can accelerate damage. Fourth, your blood pressure medication dosage. If your blood pressure is running below 120/70 on medication, your kidneys may not be getting enough blood flow. Low blood pressure is just as dangerous for kidneys as high blood pressure. Here is what protects your kidneys. First, water. 8 glasses a day is a starting point, but if you take a diuretic, you need more. Watch the color of your urine. Pale yellow means you are hydrated. Dark yellow means your kidneys are straining. Second, beets. A single cup of beet juice contains nitrates that improve blood flow to the kidneys. A 2019 study in the Journal of Nutrition found that dietary nitrates improved kidney filtration markers in older adults. You can buy canned beets at any grocery store for about $2. Third, reducing sodium. Not eliminating it, reducing it. The target is under 2,000 milligrams per day. That means reading labels. 1 can of soup can have 900 milligrams. Fourth, cherries. Tart cherry juice reduces uric acid levels, which directly protects kidney function. 1 glass per day is enough. This is the Thornton kidney protocol. Step 1. Get your GFR and ACR tested every 6 months. Write the numbers down. Track the trend yourself. Do not rely on your doctor to flag it. Step 2. Drink half your body weight in ounces of water daily. If you weigh 160 pounds, that is 80 ounces. Set a timer if you have to. Your thirst signal is not reliable after 65. Step 3. Eliminate NSAIDs completely. Switch to acetaminophen for pain. If you need anti-inflammatory relief, ask your doctor about topical options like diclofenac gel. It works locally without reaching your kidneys. Frank followed this protocol for 14 months. His GFR went from 47 to 52. That may not sound like much, but in kidney medicine, any increase after 70 is remarkable. His ACR dropped from 45 to 28, normal range. His new doctor told him he had likely added years before needing any serious intervention. All because one nurse practitioner circled one number. Write your age below. And tell me, have you ever looked at your GFR number? Do you even know what it is right now? I read every comment. Here are your 5 takeaways. 1. Ask your doctor for your GFR number at your next visit. 2. Request an ACR urine test if you have never had one. 3. Stop taking ibuprofen and switch to acetaminophen. 4. Drink half your body weight in ounces of water every day. 5. Track your GFR trend over 3 to 5 years, not just a single number. I made this channel for one reason. The information your doctor knows but does not have 12 minutes to explain. I don't sell supplements. I don't have a clinic. I profit from you not needing me. If this helped even one person check their GFR for the first time, it was worth making. I'll see you in the next one.